Natalie, and I'm going to be working with you today on a series of exercises that are appropriate for most chair-bound seniors. Remember that with any exercise program, you always need to get clearance from your doctor first, as they know any specific medical conditions that might need to be addressed before you exercise. But these are pretty general exercises, and so we'll just kind of move through how they work, and hopefully this will be something that you can use. The first is the neck stretch. So we sit up straight and tall in our chair, really focusing on posture, tucking the hips under, getting the spine in alignment. Rotate the neck to the right. Pause, back to center. Inhale, make sure you're sitting straight and tall, and rotate to the left, looking over that left shoulder gently. You repeat this exercise several times. Again, thinking about posture. The next exercise for the neck stretch is just a tilt, keeping the chin in line with the body. So you don't want to tilt up too high or too low. The chin is very centered, keeping the spine and the neck straight. Up again, and to the side, to the center, to the side, and center. Repeat this again several times to loosen up the neck. Take the right hand, gently place it on the head. Continue that same motion, tilting down. Gently use the weight of the hand to pull the neck. Again, not tweaking or really jarring the neck, just a nice gentle pull. Take the right hand down, switch hands. Again, here, good posture, tilting, the chin is in a neutral position, and lightly pull. Again, repeating that several times on each side. Then we can do a chest stretch. Place the hand on the shoulder. A shoulder stretch. Placing the hand on the shoulder. Twist the upper body, thinking about engaging the abdominals and twisting to the side. And then you can add a little neck stretch there, looking over the shoulder. Come back to center. And the same, twisting the hand in the direction of the hand, looking over the shoulder, and then look back over that opposite shoulder. So really having the client sitting up straight and tall in the chair, holding in the abdominals and letting the abdominal muscles pull and the shoulder muscles pull the body. Nice. For a chest stretch, place the hands on the knees, swing the hands out to the side, sitting up straight and tall, trying not to arch the back, open the chest up wide. Take a nice deep breath in and exhale. Good. Bring the hands back to center. Repeating this exercise again several times. Open the hands up wide, try not to arch the back. Draw the shoulder blades together. Take a nice deep breath in and exhale. Good. Shoulder rolls are exactly what they say they are. Sit up straight and tall in the chair, rolling the shoulders back 5 or 6 times and then to the front. Really rolling through the shoulders. If you've had any kind of a shoulder replacement or shoulder injury to the clavicle, this is definitely an exercise that you would need to get clearance from your doctor on. Good. Shrugs, draw the shoulders all the way up to the neck, to the ears, and let them go, release. Shrug them all the way up again, and release. Draw those shoulders up, and let them go. Good. For ankle stretches, again, any kind of knee or ankle injury, any kind of knee or ankle pain in the joint, you definitely want to get permission for doing this exercise, but it's just a simple ankle stretch. Lift the right foot, point and flex the ankle several times, and then circles to the right and circles to the left. Switching feet, point and flex that ankle, circles in and circles out. Good. For torso rotation with the ball, you can take any household ball or unweighted ball, sitting up straight and tall in the chair, draw the shoulder blades together in the back, gently hold the hands, grasp the ball in between the hands, hold the abdominals in, and let that ball rotate you to the right. Eyes follow the ball, so we're not swinging the ball around and bending the right arm, we're letting the ball with straight arms take us in the direction. And then back to center, and then to the left. Again, squeezing through the lateral muscles, drawing the shoulders back and down, keeping the arms as straight as possible and head in the same direction as the ball, and back to center. We can also make that a nice rotation, practicing sitting straight, holding our bellies tight. 5 or so rotations to the right and to the left. Keep those arms as straight as you can. Lift the arms up overhead as high as you can. Nice big circles. Good. For a chair stand, if you need a walker or assistance, that's absolutely fine. You can certainly reach out to someone to help with that. But we would like to get the client up to standing and work a little bit on those quadriceps and glutes and do some squats. So again, if any knee issues are there, we'd like to take that into consideration. But you're just going to have the client squat down in a good squat form, fanny out, perhaps holding onto their balance or a chair, squatting down. So you can take that chair here. This is what that looks like. You can either have them squat down into the chair, nice squat practice here, or you can have the walker squat down, almost touch the chair, or touch the chair and come back up. So just practicing getting up and down. We have an upright row. If you have a resistance band, this is a wonderful tool for the upright row. Client's feet go in the resistance band. They sit up very straight and tall at the end of the chair. Row the band up, elbows go higher than the wrist. Sitting up straight and tall, pulling that band alongside the body. Good. Just like that. You can also do that with a light weight. Weights sit in the lap. Pull up straight and tall, elbows go high and down, elbows up and down again. So we wanted to do between 5 and 10 repetitions of those exercises 2 times. All right? For heel taps, again sitting close to the edge of the chair, take a nice little bend back, little hinge at the waist, draw the left knee up to the chest and tap the heel down. You can do that 10 times on one side. The client leans back. You want to try and advance that without hands, but you can certainly keep the hands on the chair. Chest is up high, abdominals are tight. Working on the hip flexor muscles here. 10 times each on each side. I'd like to do 2 rounds of that. Again, if there's been hip replacement or any kind of injury or surgery, that's certainly something that should be discussed with your doctor before you continue. All right, so some extensions with the resistance band you can also do. Hold the band out in front with arms as straight as possible. Just resist pulling the scapula together here. You can also have hands at a 45-degree overhead and again resist. So you may go as far as an open chest, but with a straight arm, resistance here is a beautiful exercise. We also have lat extensions, lat raises, so the weights rest vertically on the lat with a nice sweep, 90-degree angle, arms out to the side and down. Chest is up high, pulling the shoulder blades together, sitting up straight and tall. Okay, nice little raise. You can do a leg extension with a light weight or no weight. So sitting straight and tall on the chair, extend the leg out, lower and raise, lower and raise, lower and raise, and then switch sides. Working on getting the legs up. Good. If you're in a chair that has arms and you're working with a client who is having trouble getting up out of the chair, it's a great exercise just to have them place their hands on the arms of the chair and use their body weight to lift themselves up and down and up and down so that the focus is on the upper body, not so much on the legs. But they're just trying to push themselves up off of the chair. Let's see. Just a little circulation exercise. You can use what are called gliders or paper plates or also just a rubber ball, just to keep the circulation moving in the leg. Place the ball beneath the foot and circle around, and then around the other, working the knee joint. Here as well, nice circles on the left, and then the other. We also have a series of chest presses that you can do with the ball, pushing the ball together 10 times. take a break, and then another set of 10. And the last little set of exercises have to do with balance. We definitely want to use a chair or a walker to help with this exercise. So we're standing very straight and tall, just using the chair for balance help. Extend the leg behind, kicking out, trying to keep those hips very, very stable, squeezing the glute muscle 10 times. Trying not to lean to the left if you're using that right foot, but standing very straight and tall, kicking out 2 sets of 10, and then also to the side. Again, trying to keep those hips very stable, and then trading sides and doing it there. That's a whole series of just very simple exercises that you can do with a senior. I hope that you find that helpful and that you pass this video on.